the Lyndon Baines Johnson Hospital, but particularly the Harris Health System with Dr. Portia as CEO, the Board of Trustees, and as well the Harris County Commissioners, including Judge Hidalgo, and the Commissioner for this district, which is Commissioner Rodney Ellis, who I spoke to this morning, to let everyone come in again to see what is prepared for the coming weeks. And this is not a mirage. This is not hysteria. This is preparation. The reason why it's not up and running is because we are looking for the staffing and the nursing, even today. In the last week, we had 151,415 cases in the United States. The real issue is that the reasonable infection rate, where you can really deal with the issue medically, is 10%. Harris County at this point is 19, almost 19.5%, and the number may go up. They were 18%, they're now 19%. There is no doubt that the spiral is going up, it's not going down. So last Thursday, I came here I came here last Sunday to walk through the hospital. And at that time, there were people in the hallways, in the chairs, and nurses who were on staff spoke to me about the dearth of nurses, the lack of nurses, and it is spread throughout the Texas Medical Center, as stories have been told, and as well through our public health system throughout the state. Nurses are being needed and are not present, not because of their own desires, but because they're not enough. And so it was at that moment, as I have been engaging with state leadership, from the governor's chief of staff to other leaders, asking them to follow federal protocol and to call the federal government to ask for help. As of last Thursday, the governor had still not asked for any form of help. And I say Thursday a week ago, that he had not asked for any help. That puts Texas in a crisis that is unnecessary. It adds additional burden to our medical system. So in my call for federal assistance, very glad to say that this morning I finished a call with Jeff Zients of the COVID-19 team. We are going to be working with the Secretary of Health and Human Services and FEMA. And with that in mind, the only element that is needed is for the governor of the state of Texas, as the Mississippi governor did, as the Arkansas governor did, as the Arizona governor did, to begin to raise their voice for services that are needed here in Texas. Let me share with you what Arizona received. They received National Disaster Medical Services on the ground. Mississippi received National Disaster Medical Services on the ground, public health, nurses, and others. Louisiana, the National Disaster Medical Services on the ground. When they come on the ground, they can bring equipment. They can staff facilities like this. They can bring nurses. Now, in the aftermath of my call for federal assistance, the governor gave a lukewarm response, which is he gave permission for 2,500 nurses to be added to the inventory that the hospitals themselves, the county themselves, the private hospitals themselves could contract for private hospitals in the private hospital market. I have no opposition to that. Wherever you can get a nurse, you should have a nurse. It was right at this hospital where I announced the partnership to have nursing students help in these very special occasions. I'm very glad to say that standing next to me are the second-year students at Lone Star who will be prospectively part of this progress and this program. Lone Star has interacted. HCC is ready. The hospitals have communicated, and they have developed the protocols for these nursing students to come in numbers from now until we hope maybe this particular surge is over. We're doing everything we can, but what is missing is there's no government response. When I wrote the letter to Jeff Zients on August 9th, I specifically asked and indicated at that time we were 18.8% infection rate. I indicated the schools coming in, but I specifically asked, and I said, to all of our dismay, the TEA has sent out guidelines regarding school districts that are insufficient to protect the health and safety of children, teachers, and parents. TEA guidelines do not require school districts to mandate masks, to contact trace, or to inform the classroom if a student has tested positive. These guidelines will prove disastrous in both crowded urban schools as well as rural schools. Jeff agreed, and as you well know, late last night, they called me to say the Secretary of Education agreed and was sending out a very strong letter to both the governor of the state of Texas and Administrator Moran. The gist of the letter is that you shouldn't stop contact tracing. You shouldn't stop protocols that are in compliance with the CDC. And we are going to be reviewing whether or not you're in violation of federal rules or requirements under the emergency pandemic by blocking these school districts all over the state from doing what they believe to be protective of their school children. I asked the governor to waive his executive order against counties and hospitals in terms of fines that he would render. Even if he had this executive order, I asked him to give a break to our school districts who really have no money to pay for any fines or violations. I do, however, applaud Harris County. They got an initial victory on the TRO, and Dallas, who are counties that sued the governor because he is patently wrong. But what I am glad to say is that the letter that I think is in that other folder, or in this folder, let me see. That's the letter to the governor, and is this a letter to
Governor Abbott
and the commissioner? Yeah. So I think it's important to know that the federal government wants to come here and help Texas. That's why I'm here today, to emphasize the crisis that we're facing, to show the nurses, to let Mr. Mills speak and the other nurses speak again so you don't hear from me, to look at the beds, that when there is a surge that is going up and down, then we will have the ability to confront this. Now let me say this. I represent a majority-minority district. It is a voting rights district. In all of my institutions, no matter who you are, I'm fighting to get federal dollars here. There's no race litmus test. Young people are in these beds. Senior citizens, some of them are in this bed. Funerals are being had for people who are dying of COVID-19 complications. I have witnessed one. I have witnessed many. I have witnessed recently. And every day we're hearing about numbers of people in our jurisdiction are dying. But I think I would be remiss if I did not indicate that the large numbers of people who are now in ICUs, who are dying, are Hispanic and African American. I don't want our state to be known as a state that has a caring attitude about one group, but not a caring attitude about any. I don't have that bone in my body, which is why I am screaming at the governor to say that we cannot discriminate because one group is in high numbers versus another. Because in various parts of the state, you will find many diverse persons. You will always find young people of any background. But in this urban area, we are suffering of all ages, of falling like flies with COVID-19, the Delta variant. Now, it is unvaccinated persons. So I'm going to get several things done. The federal government is going to help ramp up testing to get back to testing people, because people are infected and they're going and infecting others. So we dropped testing. We need to start testing back again. And frankly, I believe that businesses and schools and others can require people to be tested and to bring in a negative test. That's something we can think about. Because I am hearing stories during the week of an infected person going into an office and infecting the rest of the office. But yet the employer cannot ask whether the rest of the office is vaccinated. It so happened that some of the people were vaccinated and their lives, the disease did not impact them as drastically as it could have. So I'm looking forward to hearing from Secretary of Health and Human Services, who I've already spoken to before. FEMA is available and standing ready, and the COVID-19 task force is ready as well. But the missing element is the governor of the state of Texas. I'm going to be looking for many options to be able to bring these resources. We're not finished yet. We will find many different creative ways to bring these dollars here. I wanted to read just a brief amount from the letter from the Secretary of Education, which goes directly to my letter. Texas' recent action to block school districts from voluntarily adopting science-based strategies for preventing the spread of COVID-19 that are aligned with the guidance from the Centers for Disease Control and Prevention puts these goals at risk and may infringe upon a school district's authority to adopt policies to protect students and educators as they develop their safe return to in-person instruction plans required by federal law. So I believe this gives grounds to our school districts to sue the governor because he is violating federal law. If he wants to mount up the number of lawsuits, then let him do so. The department also says it recognizes that several local education agencies in your state have already moved to adopt such policies in line with guidance from the CDC for the reopening and operation of school facilities, despite the state-level prohibitions. The department stands with these dedicated educators who are working to safely reopen schools and maintain safe in-person instruction. They further go on to criticize the particular provision that does not allow contact tracing. We expect some other letters and communications to come. I hope the governor does not have to be coerced. I hope he will do what he needs to do. My final point, reiterate, the governor did give permission for 2,500 nurses on the contract process, private contractors. We are a 30 million plus state. We are huge. The 2,500 is not enough. It will not be enough, and it will not in any way answer the crisis of a big medical center, of a Harris Health, of hospitals in Dallas, of rural hospitals. It will not meet the test. Finally, to tell jurisdictions to use their CARES money, which they explained to me was for specific items, some of it depleted, is unrealistic as well. When the federal government will be able to give practical responses and practical logistical help right now as we speak. Why shouldn't we get the National Disaster Medical Team on the ground in the state of Texas? Why should we be discriminated against? Governor Abbott, I want to work with you as I have called all of your staff and have found some very interested. I would appreciate you doing what the other governors have done and not suggest to hospitals that they should not do elective surgeries. As doctors have said, some people's elective is life-saving. Doing the antibody infusion is a good thing, but it is not unilaterally the answer. Some people have to be in ICU. Some people have to be hospitalized. So I want to know, why these empty beds? Why are these empty beds? Why are people in hallways? Where are the nurses who can relieve some of our nurses that have been going since March of 2020? I'm delighted today to have Dr. George Williams, who is the Chief Medical Officer of the ICU, one of the ICUs here in Harris Health. I'm not a clinician, he is. And I'd appreciate, Dr. Williams, if you come and share with us where we are in your landscape, the demographics of the individuals that you see, and whether you think 2,500 nurses, I don't want to put words in your mouth, is going to be the final answer to what you need. Dr. Williams, thank you very much.
Thank you very much. Thank you so much. Thank you, Congressman Lee, for your leadership, and appreciate the opportunity to come share today. what we're seeing clinically at the bedside is younger patients who've gotten much sicker much faster. People in their 20s and 30s, with a predominance of minorities that we're actually serving in this community. And so these are patients that in many cases, in most cases, the vast majority have not been vaccinated, and we're doing absolutely everything we can to help them. But these are patients that look like me and are younger than me. And so we are doing our very best to meet that need at the bedside. But as patients get sick from COVID-19, the critical illness that's related to COVID-19 involves a lot of invasive procedures. Most times it involves being put on a ventilator when they actually end up coming to the intensive care unit. And patients are relegated to a very prolonged course of very severe illness, particularly when not vaccinated. So a couple of key points just to make. Right now we're very grateful for any help that can be provided. Certainly grateful for the nurses that have been provided thus far. Considering how bad our staffing issues are right now, and considering how many patients that are waiting in the hallways, we've had ambulances that have had to wait outside the hospital. If it's possible to send help, now's the time. That being said, the other thing to communicate to the community is that the best thing to do is try your best to minimize your likelihood of getting severely ill. Wash your hands, maintain social distancing, wear a mask in public, and please get vaccinated. Everyone has access to vaccines regardless of how much you make in terms of your money or where you live. Everyone has access to vaccines. Please do what you can to protect yourself, your family, and your community. Thank you again, Congresswoman, for your leadership. I appreciate the opportunity to share.
Thank you very much. Thank you. Let me invite Mr. Bills up as well. Your hands-on and your neighbor here. You just stand up, and then both of you would share your thoughts. I was here with you before.
Yes.
We're in a unit that looks very pristine, very good. Looks like you can handle people maybe at the first stage of COVID. I'm not a doctor, I'm not a nurse, but I know that this is a very important unit. Share with us what the challenges will be at this time.
Yeah, so I think for me, I look at 4 points. First of all, I want to echo Dr. Williams thanking you for you're attacking this issue and for keeping it top of mind for the nation as well as the state. I think that some information that was shared with me has to do with the number of nurses that were down. As a system, we're about 21.5% down. Just here at LBJ, though, we're higher than that at 26.6%. This is a magnet institution, LBJ and Ben Taub, and while that would attract most people to an institution because of this disease, because of the monies that are being provided by other institutions, they're being drawn away. Number 3, I think I want to applaud the executive leadership here at the system for the amount of money that they put forth towards increasing nurse pay, retention pay, as well as trying to incentivize people picking up extra shifts. And then finally, again, I don't think you can say it enough, follow the science, wash your hands, wear your mask, socially distance, and get vaccinated. Thank you.
Introduce yourself.
Sure. I'm Renee. I'm one of the nurses here in the EC. I don't have anything prepared, but I do want to say that this is, in my 4.5 years here, the most taxing time I've ever seen on nurses. Emotionally, physically exhausting, and we can't sustain this level of ICU patients in the ER. It's more than I've ever seen. We are exhausted, and the nurses are working so hard. I applaud them so much. They're doing such a great job, but we need, like you've been saying, we can't express enough how much we appreciate you fighting for us and fighting for the city of Houston.
That's a personal story. You didn't need to make any remarks that are prepared. I want to emphasize, and I want to close and answer questions. I do want the student nurses who are second year just to introduce themselves. You've heard what we're doing. You're in the Nursing Partnership Program. You're not scheduled yet, but if you want to introduce yourself. second year student.
Yes, correct. My name is Ashton Sonye. I am a second year nursing student. I just want to say thank you for having us here, and we are eager to get in there, to practice the training, to get treatment right under the direct supervision of RNs. But we're eager to get in there and help, seize this crisis. This is definitely a crisis, a health crisis. So we're ready to get in there and practice those skills, give help to our community.
Soon, you will get in soon.
My name is Ashley Cook. I'm also a second year student at Lone Star. And I have to agree, we have been struggling to get experience. That has been the biggest issue that we have had. And we are so ready to be there. We're so ready to have the experience.
My name is Daisy Castañon. I'm also a second year student. And like my fellow classmates said, it's just been really difficult for us to get the experience. Not many hospitals are opening their doors. I want to thank HCA. They really have helped us gain our experience. So I hope more hospitals start opening their doors for us.
My name is Anna Blasny. I'm also a second year nursing student at Lone Star North Harris. I feel like my co-students really put it perfectly. We are just really ready to be able to get in there and help out our fellow nurses and help the public.
So they will be part of Lone Star's commitment to the Nursing Partnership Initiative, and they will work with this Harris Health System and funnel those student nurses, second year mostly, to operate under an RN. But what you've just heard are RNs who are on the ground indicating the level of exhaustion, not the level of giving up, but the level of exhaustion. 2,500 nurses in the contract system will not work and will not last. And so we should not wait any longer for a federal response to get the disaster team on the ground. I'll be listening out for additional efforts by the administration, but it's most important for our governor to be able to do what he's assigned to do, which is to make that call. I am baffled by the fact that that call is not being made. But even without that, we're going to be working with our local governmental entities and trying to do the best we can to bring them federal resources. We will not give up, and they wanted me to say to you today, the White House, the COVID-19 team that is facing the crisis, talking about boosters and looking to counter as much as possible the surge, they will not give up. I do want to end on this. Vaccinations, vaccinations, vaccinations. But alongside that, they were willing to ramp up the idea of testing resources to be able to help Houston and any other community to ramp up their testing as well. We need all tools to stop people from dying. We need all tools to stop people from getting so sick that they can barely breathe and they fill the ICU units. Dr. Williams, why don't you come up, stand by me in case there are questions that they may want to ask. I'll take questions at this time.
Congresswoman, are these medical grade tents the same that were set up at NRG last year, same type? I don't know if you got to tour those.
Oh, I did.
Is this what was at NRG when they set up those mass tents out there?
Similar, you're absolutely right. They probably were a little newer. I know King Hillard won't mind me saying that. But this is a MASH unit. This is the same kind of unit that Dr. DeBakey, that many have got to know, helped establish in World War II. And when I visited Iraq and Afghanistan, these are the kinds of units that they use right near the battlefield to take wounded soldiers where we were able to save lives. I've seen them in operation. They can operate on people in here with the appropriate protocols and doctors and nurses. And they can tend to people right here. You can see that they're ready with equipment and monitoring equipment. So yes, this is what they had over at similar NRG. I think it was a little bigger, but this is what they had.
And Dr. Williams, can you clarify, this tent is all set up? Is it not operated or in use because you don't have the patients that are needed to fill the beds, or you just don't have the staffing right now?
Right now, we actually do not have enough staffing, from my understanding, to actually be able to staff all these beds. In fact, if you look in our emergency department, you look in the way the beds are allocated throughout the hospital itself right now, we need more staffing just to be able to take care of what we have in the hospital alone, let alone this as well. So any staffing support that we can have, we would we've been extremely grateful for, because that's what lets us take care of patients the best way possible.
And last year, 14,000 nurses were deployed across the state. So far, they've requested 2,500. Have any of them arrived? Are they on the floor right now, or you're still waiting for them?
No.
We're still waiting for them right now. We're hoping they come soon. I believe they may be getting here beginning of next week, and I think our team can provide that to you. But I can see the difference in terms of how many nurses we have at the bedside now, and the availability of those nurses, and the ability to use the facilities that we have just to take care of patients. Right now, we don't have that same level of support yet.
And then paint the picture for us. Are we still seeing patients in hallways being treated? What does it look like inside the hospital for that viewer that can't see that?
So in the hospital, we have patients waiting in the emergency department many hours, when our normal process is to get them out of the emergency department into the ICU right away within the hour. We have patients on the floor who are getting more oxygen and getting more support than they would normally get on the traditional hospital floor, because we don't have enough ICU beds that have staffing to take care of those patients. We have our nursing team and our physician teams getting stretched thinner and thinner to take care of all the COVID patients that are throughout the hospital and our ICUs right now. So it is a very serious situation. We're doing absolutely everything we can to provide equitable and great care to every person, but we need the tools, we need the support to do that.
And the Congresswoman echoed this. 2,500 for the entire state have been requested. Is that even close to enough? What is needed not just at LBJ, but at the Texas Medical Center, Dallas, Austin, across the state?
Well, I can't comment on the across the state, because I can tell you what I see right here. And right here, we definitely need more nurses to take care of the patients that we have right now. And if other hospitals are experiencing the same sort of conditions which we are, which is the indication we have from the information, then yes, I would expect that we would need more nurses, most likely across the region.
You need them right now.
Yes, we do.
When will you anticipate that this will actually be open and patients can actually be treated? And additionally, I just want to clarify, is it COVID patients that will be in here, or people who need a bed period, regardless of if they have COVID or not?
Well, I can say that as soon as our staffing capacity and bed needs will dictate this be available, then we'll put patients in here right away. With regards to whether that's COVID patients or not, this is designed for COVID patients. And we have barriers, we have processes and equipment and drugs located in a way to make sure we can take care of COVID patients here. Even the monitors and the way everything's set up is designed for COVID patients.
And what's the capacity in here? How many patients can you actually be treating in this facility?
So in this tent, which is expandable, we can currently treat 6 patients in here. And that may sound like a small number, but considering how full we are in the hospital, 6 patients can make a very big difference considering our current circumstances.
And I know we've been talking about it all this week, but many physicians in the healthcare system have said that we've reached our breaking point, but are going to see more cases increase. Is that what you guys are seeing here? Are y'all at your breaking point?
I think it's very safe to say that right now we're absolutely bursting at the seams. Everyone is exhausted. This has been a 1.5-year process for all doctors, nurses, respiratory therapists, the entire team, and more is something that is just difficult to see how that can be tolerated at this time.
Now, if you can say, if you have one message that you can get out to the community, and also those who have the resources to help you guys, what would that one message be?
Please send help now.
And I wanted to clarify the numbers. I didn't catch the other doctor's name, but he said 21.5% down system-wide and then 26.5% down here at LBJ. Were those numbers related to the number of nurses you're short-staffed? Like,
Yeah,
you're
that's the
missing
vacancy.
25% of your nurses right now?
Yeah, that's the vacancy rate, both at a system level and at LBJ.
And when you say system level, is that Texas Medical Center?
Well, Ben Taub and
Ben Taub.
LBJ.
Like here, you're 25% down when it comes to nurses.
26.9 actually.
Wow.
Harris Health is the public health system of the city. Another number is over at Texas Medical Center. The 2,500 that the governor's put on the street saying you can get them is for the whole state of Texas. And you made the point, 14,000 before. Children going back to school, debates about masks. Children under 12 cannot be vaccinated. One thing is a known factor. I'm not a doctor or a nurse. Is that the Delta is very infectious. And so passing by various things that we did in the past where people said, oh, you don't have to do anymore, it's very infectious. And so what we have to do, if you're in the medical business, the care business, you got to project what is going to happen in the end of August or September when colleges and primary and secondary schools are going back, and teachers will be back, and bus drivers will be back. And that's what I've been saying. I don't know how we can deal with 2,500. They're being very kind. They made the request. They don't have the nurses yet. We hope that we'll see them. But they don't have the nurses yet. So when they get through with that allotment, then they may need another allotment depending on the surge. The best news would be all of this ends. But most of the scientists and doctors across, and I'd like you to comment, and I don't know he won't mind being called a doctor, but he's a wonderful nurse, Mr. Mills is. So I just want to make sure, and he loves being a nurse for 40
years.
40 years. So he should be applauded, all the nurses that. But could you speak to the idea that we wish it would end tomorrow, but you don't see a forecast in terms of what you're seeing that this Delta and surge is going to end? I think they're interested in what you see going forward. Thank you.
So no one can predict the future, neither can I, but I can say the things that we see. The Delta variant is much more infectious and spreads much faster than the previous variants. And so that's why the CDC revised the guidelines to recommend wearing masks in public, recommending still keeping the social distancing, washing hands, and vaccinations. And so if as we see a more infectious variant and we see cases going up, all of our modeling right now still shows cases going up. And we're at the breaking point now. So please do everything you can to protect yourself by getting vaccinated, doing all those things we just talked about, washing your hands, social distancing, and making sure that you protect your community. The other thing that's very important to say is that children cannot yet be vaccinated. Because children cannot yet be vaccinated, we need to make sure that we're doing everything in your home and in our communities to let our children wear masks so that they can reduce their likelihood of getting infected as well. Because we're seeing younger and younger people get infected by the Delta variant. Thank you.
One last question. I know that we had talked about what's being seen inside the hospital, but I also had a viewer who reached out to me. They too, their friend had to get airlifted to a hospital in New Mexico, and they came here to LBJ. If you guys do not get the nurses and the staff that you need, could people potentially expect their loved one to have to be transported to a hospital where there are available beds?
Absolutely. Yes.
That can be expected within the next coming weeks.
If we're ever in a situation to where we simply physically cannot fit the patient in the appropriate facilities here, we have to reach out to partner hospitals, even in different states, to make sure we get them someplace where they can get the care that they need. So that's why we need staffing here, so we can take care of those patients here. We don't want to put people through the risk of being transported a long distance in order to get the care that they need.
And just your first name, you and your position.
George Williams, and I'm the medical co-director of the surgical ICU here at LBJ.
Thank you so much.
Let me conclude, if you all, thank you, Dr. Williams, thank you to all of the nurses. As I said, let me indicate that about a week or 10 days ago, we initiated the nursing partnership. I hope that we'll see more of these students coming in. They have to be under a trained, certified, licensed RN. As our nurses have said, they're at the breaking point. As the doctor said, they're at the breaking point. That is why I mentioned 151,415 cases, the largest that we have seen in the last week. These are cases of infections across America. People are still dying, a 19% infection rate, and we are working as hard as we can. I'll be at the Greater Love Church in just a few minutes with a vaccination. I hope when I get there I'll see lines. And I try to get embed into the neighborhood where Hispanics and African Americans live together and overlap, though it is open to everyone. But the issue is we have these vaccination sites. We're still dealing with vaccination hesitancy. So I indicated to the president in this letter and to Jeff that this is a state that needs help. And we need the federal help, how they can dispatch, even if it's military. We need to be able to receive it. And the question should be asked, why the governor will not pick up the phone and indicate, I need federal assistance. It is not intrusive. It doesn't deal with any state laws. They go straight to the medical facilities, and they try to be as helpful as they possibly can. I feel for these nurses. I think they're at the breaking point. They're 12-hour shifts. That is their shifts, but over and over again. And I feel for the doctors who are the core system working with the nurses to develop patient care. Remember, we've been told to not have elective surgery. I'm not a physician. I'm told that sometimes elective is important for someone's quality of life. That's the treatment that we're getting from the state, which is, here, help us out. Don't have any elective surgery because we got to put the COVID patients in. I don't know if that's the best answer. In fact, I don't want to put you on the spot, but sometimes when people don't get elective surgery, isn't that something that you wish you didn't have to do? And then maybe you can explain better than I can.
Absolutely. So while elective surgery may not be an emergency, sometimes people have severe back pain. Sometimes people have cancer surgeries that they need. Sometimes people have conditions that affect their daily life. And the more we can't provide those treatments, the more they're not able to introduce themselves back into society, be productive, and have a high quality of life. Most people don't have surgery purely for the purpose of doing it. They are trying to treat a condition, and not having those facilities to provide that intervention, that surgery, prevents that treatment from occurring. So that's a very important point. Thank you, Congressman.
And that's what's being asked by the state. They're asking hospitals not to do elective surgeries. They're asking them to make sure that they send people to infusion centers. Some people are way too far gone, and they come straight to the hospital. I do think it's an important point to make that potentially more patients will be airlifted out of the public system. And remember, the public system treats certain patients with certain economic needs. This is where they go. So they don't have options in the private system. Even though a private system is working to help as many as possible, this is where they go for everything. And the baby that had to go, because there were no pediatric beds, and this is not a pediatric hospital, so they had to send the baby. But you do have pregnant.
Yes.
You have OBGYN. And so just think of someone coming to have a baby here and the difficulties that they'll face. I'm hoping to hear from the governor in actuality, and I'm hoping that we will not be in the same crisis next week. I could do without that. But I hope my voice is making it very clear on what we need and what we need now. Finally, I just want to say this is redundant. Get vaccinated. Do the social distance and wash your hands. It sounds like more than a year ago that we did the same thing. No one could ever believe it. But now you've got infectious levels that are far superior to COVID original. Delta is far superior in its infection, and some people get sicker with COVID-19 Delta than they did before. So thank you very much. Thank you very much, Dr. Williams. Thank you to the nursing students. Thank you very much. I want to read the name. Renee. Thank you, Renee, leaving her last name out. Thank you, Mr. Mills. Thank you for the truth that you gave us today, and we appreciate you all very much.